Welcome to another edition of Supplements and Sport Spotlight, presented by Mad Fit Industries, Mike and Dan Fitness and Sports Medicine Incorporated. Today's edition is on fish oil, specifically fatty acid supplementation facts and future directions. So what are the facts for fish oil supplementation? It is a nutraceutical, meaning that it is used to help with overall health and well-being. Sometimes called krill oil, or also identified by its specific fatty acid makeup. It is actually consistent of omega-3 polyunsaturated fatty acids, the specific three being EPA, DHA, and ALA, with EPA and DHA being the ones that are found in fish oil supplementation. It is very important for proper nutrition and overall health, particularly muscular activity, blood clotting, digestion, fertility, and cell division and growth. DHA is important for brain development and function, and it's typically combined with structured nutrition and exercise for its benefits in health and for sport. So what are the things that are a little bit fishy or that we're not quite sure about? Fish oil supplementation may help lower triglyceride levels in blood, reduce risk of heart disease. It's been shown in some studies to relieve symptoms of rheumatoid arthritis, can be protective against or promote recovery from both brain and or eye dysfunction. And some literature is suggesting that it might help improve workout sports recovery, reduce muscle soreness, assist with burning fat, and help slow or mitigate muscle atrophy. There are some things that we know about fish oil that are not true. Fish oil is not a traditional prescription drug or medication. It's not used to cure, mitigate, treat, or prevent any specific disease. And it's important to note that it is not the same as fish liver oils, which contain vitamins A and D, and thereby can be toxic at higher dosage. With regard to side effects and dosage for fish oil supplementation, generally there are no side effects. When they are present, those include minor GI symptoms such as belching, particularly with a fishy odor, indigestion, or diarrhea. Dosage can vary, but for the usual adult dose, it would include 2 to 4 grams taken by mouth orally daily in 2 to 3 divided doses. Adjustments and modifications are often made for those who have kidney or liver dysfunction. Now, there's been ongoing research and investigations into the effects and benefits of fish oil supplementation. There's been ongoing research specifically for its cardiovascular benefits, including assisting with aerobic endurance and reducing the cardiovascular disease risks and complications noted earlier. New research, however, has been shown that there are quite a few possible benefits for the athletic and active populations. In December of 2015, Evan Lewis and colleagues did a study over 21 days looking at omega-3 fatty acid supplementation versus olive oil placebo. In the study, they found that there was increased muscle activation and neuromuscular function during sprint cycling performance that was maintained from an attenuated Wingate percent power drop, identifying that there may be an ergogenic aid for trained individuals. In May of 2014, Barrett and colleagues performed an overall review of omega-3 fatty acid supplementation as a potential therapeutic aid for the recovery from mild traumatic brain injuries or concussions. In that study, they identified that our understanding and pathogenesis for the long-term effects of concussions increases, so too does our ability to design effective treatments for these injuries, and as such, there is a growing body of preclinical literature suggesting that omega-3 fatty acids, and particularly DHA, may play a therapeutic role. Currently, there's not quite enough evidence to support it unequivocally, but we have the early stages and groundwork. Just earlier this year, in January 2016, Oliver and colleagues at Texas Christian University in Fort Worth, Texas, performed a randomized, double-blind controlled study with 81 of their NCAA Division I football athletes, wherein they provided DHA in a dose-dependent manner to determine the effects on a serum biomarker of axonal injury known as neurofilament light. At the end of the study, they identified what they believed to be an optimal dosage of DHA, wherein there was found to be a neuroprotective effect, attenuated levels of the NFL biomarker. It's these kind of studies that are being done that show promising results and possible ergogenic aids for both sports function as well as overall health of the individual. oils. When considering taking fish oil or using omega-3 fatty acid supplementation, don't postpone or replace conventional care. Be sure to consult your healthcare provider before using any supplements, and be sure to stay informed with all the published evidence-based research available. At any time, inform all of your healthcare providers, including athletic trainers and sports medicine staff, about any complementary health approaches that you might use, and give them a full picture so that they'll be able to assist you as needed. Some caveats and warnings. It's important to remember that fish oil is not the same as fish liver oil, and that fish liver oil does contain vitamin A and D, which at high levels can be toxic. Omega-3 supplements may extend bleeding time, and for any individuals who are pregnant, trying to become pregnant, or breastfeeding, or if they are taking medications that affect blood clotting, as well as if there are any known allergies to fish or shellfish, it is strongly advised that you consult with your primary care physician prior to taking this medication. Thanks for tuning in to this week's edition of Supplements and Sports Spotlight, brought to you by MadFit Industries.